Dallas, Texas. Yeah.
Okay. What's up, Nutrition Hero family? This is Dr. Brad Watts, and I'm coming at you again with another episode of the Nutrition Hero podcast. And yes, we're in the podcast lab today. However, we do have a phone in, a video in, a special guest for you. Our guest today is Dr. Brandon Brock out of Dallas, Texas. Dr. Brock, thank you for joining us.
Thank you, Nutrition Hero.
So
that's awesome. It's like you're a superhero, man. I don't get to talk to many superheroes. That's a pretty
good.
Cool thing.
So what's awesome is that the Nutrition Hero, the superheroes, are actually the people listening, impacting their community. That's what I'm talking about.
I love it, baby. I love it.
Yeah. Well, Dr. Brock has been called by his colleagues, if I can embarrass him for a second, he's been called by his colleagues a thought leader, an organizer, and a research engine. That is true. So how do you respond to that, first of all?
Well, first of all, that's cool. That's cool. I'm learning to take a compliment.
Hey,
okay. My therapist is teaching me to no, look, okay, I'll be very honest with you and very genuine with you. And that is, look, you got patients that are difficult. And if you get complicated cases, you do have to think about them. So, I mean, if you're a teacher and you have to think about things, I guess you could be called a thought leader. All it really is just trying to get people to think about things. I got tired of getting really a lot of mythical information, to be real honest with you. A lot of people create ideas, which I think are cool. And a lot of people create ideas, but they turn it into what's called efficacy. And efficacy is only established by real research. So, an idea is an idea and a hypothesis is a hypothesis, but efficacy is efficacy. And there's a long road of research that develops those, the difference between the two. So, I wanted to learn how to do a little bit of research so I could actually travel down that road and determine, what people think is right versus what is actually right. And somewhere in the middle is usually where the truth is, to be honest with you, because research loses veracity as well.
Right.
And then, I think the other thing that I would just say is that experience is really what I have to live by. You get enough chronic illness and you get enough exposure. And I've been very blessed to be around some fantastic teachers and other, just colleagues, man, that will give you information that you can kind of take and put it in the toolbox and use it later on. Yeah. So when you get to be an old geezer, when you lose your hair and you get to be an old geezer, I'll tell you what, sometimes if you things stick and if you can pull it together, then you're a very fortunate person.
Well, that's awesome. And one of the things that I appreciate is in kind of learning about you through your colleagues, which there's no better compliment than that, by the way.
No, I would agree with that. And that's very nice.
Is that your history in the healthcare field? Can we kind of take a journey through Dr. Brock's history? Is that okay?
Sure. I'll make it very abbreviated.
Okay.
Went to school and here I am.
Yeah. Where did you start and how did you get involved in the neurological side of things?
I'll go back to a point that I probably shouldn't go back to, and I'll make it very brief. I was in history class in undergraduate school. Somebody asked me a disease that Abraham Lincoln may have, and I said Marfan's disease, because he had acromegalic features. And this teacher I had, his name was Brother Anderson. I went to a religious undergraduate school, and it was, he was Brother Anderson. So he goes, Dr. Brock's going to be, or he goes, Brandon's going to be our doctor. And so I went down that day and changed my major.
Really?
That day I changed my major. So I was another major, man. I was a criminal. I wanted to be, a forensic, person in the government world. I didn't want to do any of this. And so I went that day and changed my major because of what one person said about one president.
It's like you felt it, though. You must have felt it.
It was a very bizarre moment. I mean, it was like it happened 5 seconds ago. So, I mean, I did that and changed my major, went to chiropractic college, got interested in neurology, became a diplomate in neurology, got out, became interested in nutrition, became a diplomate in nutrition, got interested in medicine. I went all the way through to, Duke University, got a doctorate in nursing practice, got interested in research, went all the way through to Harvard University, and became a global clinical research scholar. And, you know, that's the very abbreviated story. There's
Very
really not
abbreviated, but here you are, though.
but here I am. I'm still alive.
Yeah.
All because of one guy. And Brother Anderson had post-polio syndrome. He was very disfigured. He was a very short man. He was very disfigured, but he was an extremely spiritual guy. And he taught history class, and he knew every date from memory. And it had such an impact on me. And, you know, he just did his thing. And, you know, I don't know. I just thought, if this guy, who I held at such high esteem, says such a thing, then maybe I should consider this. And it hasn't been the same since.
Well, the hat fits, right? So that's pretty cool.
That's
so. How long?
I've never told that story before, I don't think. I've never told it. I didn't think anybody would ever care.
Well, we'll see how this goes for you.
Yeah. So, all my colleagues may now bail on me. Okay?
Right. That's right. So when you, like, how long did you, let's put it this way, how long ago did you start actually practicing and like digging into your community and serving people in that aspect?
Well, I graduated from chiropractic. I graduated from Parker initially in 1998, you know, so we're coming up on 20 years of doing things, and became a diplomate in the early 2000s. And, you know, just, I've been in school. I basically had to have a family intervention. This last Christmas, my family sat me down and they said, no more school ever. I ended up going to Harvard and Duke at the same time, and it was a really painful process. But, you know, by the grace of God, I got through it, but, you know, at the expense of everybody else having to deal with me. But,
yeah,
you know, I think the reason why I bring that up is not to shed light on me, but really to shed light on your learners, and to say that, you know, learning is a lifelong process. I mean, you never stop this. This whole functional medicine world is to me much more interesting and much more intricate and much more complicated, and, to be honest with you, in many fashions much more effective than traditional medicine. And so you really need to know your stuff. And so, you know, it's just, I'll take a moment to challenge all of your listeners that if you're really into nutrition or functional medicine of any, regardless what your background is, you know, take this stuff seriously. It takes a long time to learn it to the point to where you can kind of master it and utilize it in a way to where you can truly maybe bypass medicine in a way, or complement medicine, or do something that medicine can't do. See, a lot of people want to pretend that nutrition is a replacement. It's really not a replacement. Nutrition can be an augmenter. If you're really good and you're lucky and it's the right condition, it can replace things. But of course, that takes the willpower of the patient to do what you ask them to do.
Right.
So there's so many things that go along with this. I think people underestimate the difficulty of functional medicine. So I would challenge everybody out there to just keep going. There's not a stopping point in your learning process.
So how did you, let's take, you're taking a patient through some level of a treatment plan, and you go from point A to point B. One of the things that I've found to go from point A to point B is you got to have coaching skills. And if you suck at coaching, it doesn't matter what you know, your patients aren't going to get better. Where do you pick up some of your coaching skills? I can tell you have it just talking with you here, but where do you pick that up?
Well, my wife is a health coach. So I kind of cheat. So, you know, the way we do, you know, you know, the way we do this is like this, you know, or the way we've started developing it. And it's a very interesting and fresh idea that maybe doesn't fit with everybody, but it does fit with some people. And that is, you know, I make a diagnosis, I come up with an elaborate treatment plan, which half the time it, you know, has to change. And you guys know this is, you know, you change it on the fly. It looks great whenever you first put it together, but then of course it changes and it metamorphosizes, and you have to uncover layers and layers and layers. But, you know, my wife is, and I got a couple of other health coaches that I work with. I like them because they have, you know, bi-weekly or tri-weekly communication with the patient, and they relay the information that I have to say to the patient. They do it in these layman terms that are so wonderful that the patient doesn't have that level of anxiety from like, oh my God, I should understand my doctor. I need to understand my doctor.
Right.
So I communicate well with my health coaches. My health coaches communicate well with patients. Whenever I have to mend that gap, I have to conscientiously spend more time with the patient so that I can slow down my speed,
Yep.
use smaller words, make my sentences shorter. And I've just learned over time, I think, kind of what works and what doesn't work. And I use a lot of analogies. And then the biggest thing, man, that I do is draw things for people. They want to see it. They can keep it. They can take pictures of it or whatever. But I've learned that I can be more, efficient and do more and see more with health coaches. And I'll be honest with you, I don't have a problem saying when I'm good or bad. They probably do a better job at a lot of things than I do.
That's awesome, though. So there's great utility in delegating, and that's phenomenal. So, all right. From a neurologic perspective, what do you feel like the horizon looks like for kids, teenagers, young adults? What does that look like right now, just from a health perspective? What do you see?
Well, I'll speak from a very non-candid point. It's not medicine. I think it's going to be an integrated model. I'm giving you utopia right now, okay?
Sure.
So, and I never know if utopia is ever going to become reality.
It can for right now, though.
Okay, so let's pretend. I like that. I like that about you. Let's fantasize for a second. So, if it was a perfect world for me, it would be, somebody that has a really good practice and they're established and maybe they understand psychometric testing and they understand diagnosis. And then they can look at a diagnosis and they can say, you know what? Let's delegate this for nutrition. Let's delegate this one part for medication, because I do believe there is a place for medication in this. Let's delegate this for functional neurology, and then let's, as a team, bring all these people together so that this kid can get everything that they need, including diet, including exercise, parenting skills, coping skills for the parents. Man, I can't begin to tell you how important that is. I've seen families crumble because their kid has, autoimmune neuropsychiatric disorders, and they crumble because they just don't understand the fact that it's a reflex versus some sort of, like, they either take guilt, blame, or shame or something else, and they superimpose it on themselves or project it on one another. But anyway, in this utopian world, it would be a group of people or a team where each person fills their lane and they all come together and they make this big picture called integrative care. And it's the nutritionist doing their thing, maybe with, let's say, a leaky gut. It's the functional neurologist maybe doing something with the frontal lobe. Let's say it's the medical doctor doing something with infectious disease that might be promoting inflammation that's causing a lot of this stuff. In other words, it's a lot of people coming together and putting maybe ego aside for just 1 second and saying, you know what? Maybe this person has something to offer that I don't do a lot of, or I don't want to do a lot of.
Yeah.
But we can actually pull it together and make a program that is actually treating people, not egos.
That is so important, man.
Yeah.
I feel like, have you just been listening to our podcast for all day today, preparing for this?
Yes.
Yes. I think that's a huge thing in functional medicine. Oftentimes, as practitioners are reactive to ego. And I feel like the ego's got to be laid down if you're going to actually help people. And I just appreciate that you're bringing that up. That is awesome.
Well, I'll tell you something about ego. I think that anybody gets to a certain level. If you get to a certain level of doing a good job, there's probably a tad bit of narcissism mixed in with a tad bit of ego, mixed in with a tad bit of some other things. But until you've had the stuffings beaten out of you,
right.
You don't really know how to keep it in check sometimes.
Yeah.
And really, man, I will just tell you, experience actually does matter. I mean, I think there's some people out there that are blessed that just don't have any ego. They're just very humble people. And sometimes they're so humble that they become shy and they don't progress as far as their brain would let them. So I'm actually happy about some of the ego stuff that I see in people. I just see it as a shame whenever I see it take off and it turns them into somebody that is almost belligerent to the people that are around them and destructive, and it becomes negative energy. I know for me, There's definitely been ego in my life. There's definitely been narcissism in my life. There's definitely been humility in my life. And there's been shyness and shame in my life. But there's also been this failure in making people better, which will tame that ego a little bit. But at the same time, I'm glad I have enough of it to spur me on to want to be better.
Yeah.
So that I can actually give something back. So for me, I feel like it's an okay balance.
The ego is like the ace of spades. You just got to know when to lay it down.
I think that's a great analogy. Hell, I'm going to use that. Can I use that some other time?
That's all right.
I got a quote. Yeah, but I'll reference you. But no, it is like the ace of spades. It's like your trump card. You know, I mean, it's that one thing that gives you the energy to jump over that hurdle to find an answer that you probably would have never found before. But if you don't watch out, you'll jump over that hurdle and keep going and run people over and start causing destruction. And I think that a lot of people, once you make that one person better that nobody else has helped, it's very, very easy to take that and think that, you're something that you're really not.
Right. And you found a new protocol, right? So,
or you're some sort of guru, or, And I promise you, man, everybody that says they haven't failed or that they have an answer to everything is lying.
They gotta be.
They gotta be. If they're not, then they truly are magic.
That's right. So speaking of which, I want to talk about something that led me down the road to connecting with you here. And I want to talk about something called PANDAS. Yeah. What I would like to know is what's the background on PANDAS? Why is it suddenly on the on the table here for families across the United States? And I'm sure the world, but the United States right now is what I'm seeing in the media. And what in the heck? How is this fire getting stoked, or is the fire just getting recognized?
Well, let me give you a risky thing here, a political analogy. Have you ever noticed when people come out of the woodworks and accuse somebody of one thing, then another person jumps out and everybody gets brave?
Like the last 6 weeks?
Yeah. I'm not going to say any names. I don't want to get into it. But what I'm saying is that, a lot of people are very, very just, they're very afraid. They don't know what to do. They don't know what to say. They've been told this diagnosis doesn't exist. They've been told there's no treatment. And then when somebody does get treated or something does come up, and then one person stands up and another person stands up, what you start seeing is a movement. Albeit probably a small movement compared to what it really needs to be. Now I'll tell you how I started in this. I'll tell you why I got so passionate about it. I worked in pediatrics, in the medical side of it. And, there was a lot of vaccines, which I'm not really going to sit here and talk about being pro or anti-vaccine right now. I think there's a lot to that. However, I will say that I did see some reactions that I thought were very unsavory. So what happened is, you see a kid go from functional to non-functional. And if you're somebody who perseverates on the reason why, like I do, that's not complimentary. That's sometimes pathological. I'm just sitting there. I'm like, why in the world? You start thinking like, why did this happen? I can't just get in my car and drive off and say, work's over. Don't worry about that. I'm sitting there thinking about that family going home with that kid. And, you see that enough times and you start thinking, what is going on here? And then you start reading some things and then you start looking at it and you're like, the world is getting more and more filled with autoimmune disease. Now, there's a lot of reasons why. Some immunologists will say that 50% of it is environmental change, 25% of it is infectious disease change, and then the rest of it is, food and other factors. However you want to disperse it, the bottom line is the world is changing. So it's becoming more toxic. The food is becoming more modified. It's becoming more hybridized.
Right.
Infectious disease is being overlooked, and we have way more stress than we used to. And, there's also genetic components of us evolving around all of those things that now are making us different. So you can't really just get a calculator and add it all up and say it. But the bottom line is I really think that autoimmune disease is becoming more prevalent at a younger age for reasons that are unexplainable other than just my family had it. Okay.
Right.
And so, we've got these kids now that have infectious disease. They've got detoxification issues. They've got gut gastrointestinal issues and a number of other issues. And they end up getting a blood-brain barrier problem. They end up getting molecular mimicry or cross reactivity with their own brain tissue. Their basal ganglia gets damaged. And just picture this, man. When you talk about the basal ganglia, just picture the button that pushes on. It just continues to push on without you wanting it to. And so the brain just runs crazy. So we get OCDs, or we get ADHDs, or we get people with real neuropsychiatric disorders where they can't stop perseverating over thoughts. And the biggest thing for me was it was just instant behavior change. Very rapidly. And sometimes it did happen after vaccination. And most people in the vaccine world that know anything will tell you that. Okay. Sometimes it happens after taking a drug for ADD. So now they got so much dopamine, it ramps up their brain, and now it starts to actually perseverate, and they start to, have hyperkinetic disorders. So it's not that medicine is sinister, I think, at the practitioner level. Right. Maybe at some of the higher levels, there's some stuff going on that's not so good. But all the practitioners I worked with just thought they were practicing the standard of care. What happened is that some of them turned a blind eye to the things that were obvious and never, ever gave time to think, why in the heck did this happen? Well, I became one of those people and ended up losing that position and ended up going into neurology because I now wanted to almost, and this is going to sound really pathological to all your psychological fans out there, but it's almost as if I wanted to vindicate myself and to vindicate all the kids that had been damaged by treating kids that needed help. And it wasn't necessarily the same kids. It was just, what can I do? What can I do to help some of these people function to the point where they can have a life, man, and families can come back together and it not be destroyed and it not be filled with chaos. And the only thing that is the topic of any discussion is, what are we going to do with little Johnny this week? Versus
like when it comes down to where the rubber meets the road, is the kid going to flourish or is the kid going to get run over again? Like that's the question.
Right. And every parent, that's what they're going to talk about.
Yeah.
When there's a problem with your child, well, a lot of times you sit around and you talk about your child. I got 2 kids I got 4 kids, 2 biologically, 2 non-biologically. Yeah. But the bottom line is, you worry about them. And so when there's a problem, you kind of, as a parent, you put yourself to the side and you put that child in the middle. And when that child's always in the middle, parents don't have time for themselves, which means relationships can dissolve very rapidly. And so I saw that happening too, man. It was just, the whole thing was disturbing.
So when you talk about pandas specifically, maybe can you define that for our audience and give them a little bit of what's life like for a kid with pandas?
Well, they're little black and white furry creatures. Pandas is really pediatric autoimmune neuropsychiatric disorders related to strep, but we've found this. It's not just strep; it's a lot of different infectious disease. So now there's PANS, there's PATANs, there's pandas. The bottom line is this: there's autoimmune disease affecting the brain related to some other trigger. It could be strep, it could be Lyme, it could be mycoplasma. We found what we think. And again, I'm not getting on the efficacy or the absolute bandwagon, but what we think is multiple infectious diseases that can create an autoimmune response that now we have to deal with. It's now penetrated into the brain, and you've made a B cell antigen response. And as a result, that part of the brain is going to be attacked as long as your Treg cells are not giving you an appropriate response. So having said that, the real simple answer for your crowd is, the immune system has just decided to go beat the crap out of the brain. And now they don't function the right way. It could be anything from bedwetting to throwing fits to becoming obsessive and compulsive to just outbursts. I've had patients that have knocked their parents out in the waiting room. I've had parents that have had Tourette's so bad they can't handle it. I've had parents or patients that have screamed so loud that everybody in the building left, or at least in the clinic. It's just this: your brain is switched on and will not switch off. And it may be emotional, physical, vocal. You never know what you're going to get. Okay. So when you see that, after a while, you learn the smell, taste, and feel of pandas. and you can pick it out pretty quickly. And when you do, you can test it pretty quickly. And when you test it and you find it, there's things you can do for it. I want everybody out there to understand there is hope from, multiple perspectives and angles for people that have these problems. We know this because we've done it.
So the follow-up, the follow-through, I'm sure it's not just like, hey, this kid needs to get treated. It's a whole family deal is what it sounds like.
There's nothing in this world that makes me more jittery when I finally figure out that the person has it, needs it, and needs to get treated. Because then I have to talk about this. Well, you may need a drug and your insurance company is going to reject it. You're going to need nutrients. It's going to cost this much money. It's going to take this much time, which is a lot longer than what you think. You're going to have to be patient, and patience is something that you don't have much left of because you're already sick. So it becomes a very difficult conversation for me because I have to sit there and tell them all the things they do not want to hear, and they have to formulate a certain level of trust in me. And if they don't formulate that trust, then it's just an expensive experimental form of treatment that becomes very difficult to follow.
Yep.
And how all the things can cascade down from there. It becomes, it's difficult, man. I don't know what else to tell you other than just to say it's difficult. And so when I find it and I know it's there, you got to at least offer it.
So what's the buy-in like from a parent's perspective? Obviously parents are going to have to be basically treating their kids as a proxy. But what's a lifestyle like as far as like coaching or parent involvement? Is it heavily parent involved, or is it like, hey, just make sure your kid's doing the stuff?
That's a great question. I think that's probably the crux of the whole deal. By the time a patient gets to me, they're ready to do something. Like the family, by the time they get to me, they're like, just today, I actually heard somebody say, I say today, last night, a patient said, we've been to 38 doctors, you're number 39.
Oh my goodness.
And when you add that up, it's, I think they'd spent about $500,000, give or take. It's ridiculous. It's, the price of a freaking airplane or something. So,
right.
You get, and you start thinking about this and you start realizing the gravity of the situation very, very quickly. But, in our program, there has to be dietary changes, but we find out what they are. Okay.
Gotcha.
If we find infectious diseases, there's going to be nutrients and there may even be drugs, and I'm just being honest with you. I mean, if something has to die, it has to die.
Yep.
And sometimes it dies with nutrition. Sometimes it dies with drugs. Sometimes it dies with a combination of things. Okay. The immune system has to be regulated. And believe me, we use nutrition and sometimes we use drugs. Okay. The nervous system has to be retrained because it's already been screwed up. So once you fix the underlying metabolic problems, you've got to now fix the nervous system. And that takes functional neurological skills that a lot of people don't have. Okay. And the next thing is this. If your kid has a reflexogenic behavioral disorder, it's not that they're always choosing to be bad. Sometimes they're just reflexogenically reacting. So getting that parent down to a state to where they're calm enough to react appropriately is something that's very difficult. Like you can't just spank your kid out of PANDAS.
Right.
Okay. Or you can't just say no or yes.
Right.
So you have to sit down, you have to talk to the parents and you have to say, maybe your child is reacting in a way that they just can't help.
Right.
And that conversation is very difficult because then sometimes guilt and shame starts coming out of the parent because they've tried that mechanism.
Right.
And when it doesn't work, they start thinking, oh my God, what have I done? Or maybe, they are okay with it. But I've had a lot of parents that have walked out of the office and they're like, I can't believe that, nobody sat down and told me this. And they wonder why their kid never changes, even though they've done, some people have done some pretty extraordinary things. I've heard of shock collars getting put on kids and stuff like that.
Wow.
You wouldn't believe it, dude. I've heard just about everything. And let me tell you something. When that doesn't work, you have to sit there and think to yourself, why does that not work? If somebody put a shock collar on me, I would listen, okay, eventually.
Right.
And so you start thinking to yourself, you say, listen, it's okay to be upset. Number two, or B, it's okay to realize that what you thought was going to work is not going to work.
Right.
And the next thing is there's a reflex here that's going on that's making this person behave this way. And that doesn't mean it's okay. It doesn't mean that you're okay. But what it means is this: you can let a little bit of it go, and you can learn to cope rather than try to change. Because a lot of parents take on the responsibility of it's their fault or they're the only ones who can do anything about it. And whenever it doesn't work, it becomes this: I'm a bad parent.
Right.
And sometimes there are bad parents out there, but a lot of times there's not.
Like the shock collar parent.
Like the shock collar parent, And believe me, when you see some kids that are as bad as some of the ones I've seen, you can understand why people contemplate a shock collar.
Sure.
I'm not saying that to sound insensitive, man. I do not believe in that.
Right.
But what I'm telling you is a lot of people are very judgmental, and they're people that have never been there.
Mm-hmm.
Until you've been there and lived it, please reserve your judgment. That's all I ask, because it's bad. So
who gets this type of a situation? Is there an age demographic? Is there an isolated genotype or anything like that?
Well, let me just say this. It's a lot easier to diagnose it prepubescently. Once somebody gets a little bit older, I will say this. It becomes much more difficult to treat because people don't listen as well. They're often doing their own thing. Okay. So when they're younger, their parents can control them a little bit better and say, hey, eat this, or do this, or, whatever. Genotype, I don't necessarily know that we have a strict genotype yet. We do have antibodies.
Mm-hmm.
And I know there's genotypes that make it worse. If you have a methylation problem or a COMT problem or, a detoxification problem, it certainly doesn't help the situation, but it doesn't necessarily make somebody have PANDAS. Okay. So,
right.
But there's a lot of things that can pile on top of the PANDAS stack and make it PANDAS much worse.
Sure.
And so, having said that, it's just one of those things where, you got to look at the cause, you got to look at the underlying triggers, you got to look at what the immune system's doing, and then you got to look at all the stuff around it that can make it worse and worse and worse.
So on the sunny side of this, what's your favorite part of serving this community? What's some of your experiences where you're like, that right there, that was worth getting my 3 doctorates and whatever? Okay. What is some of the sunny side stuff here?
That's a great question. When a child talks again and they've never talked.
Okay. That just gave me goosebumps when you say that, man. That's
well, and I don't have look. I what you need to get is one of the parents of one of my patients on here.
Yeah,
that would be more than happy to talk to you. That would be something that would be much more realistic than this. I'm a doctor, and how doctors like to talk about things, how great they've done and stuff like that. Yep. What would be really good is for me to just put you in touch with some of the parents that have actually been touched and afflicted by this, and they've seen their their kids change. That would be something that would reach into the chest of your listeners and say, this is what's happened. But there's nothing better than whenever a kid makes eye contact with their parents for the first time. There's nothing better than when a kid that couldn't pick up a cup because they have side and hams problems and they can now pick up a cup and use it. There's nothing better than when a kid is now no longer scared to go to school. There's nothing better now, when the kid doesn't have enuresis anymore and they don't have night terrors. There's nothing better than when the kid actually, when they're told to go take out the trash, they take out the trash, man. People think that's so trivial. It is a big deal, man. Parents will call you up and say, my kid looked at me in the eyes and I connected for 2 seconds. And it's the first time I've ever done it. It's as if they've seen their kid for the first time ever.
Right. Like the human part of their kid. You know what I mean? That's awesome.
Well, in other words, they saw their soul.
Yeah.
And, you may see a physical formation.
Right.
But when you look at somebody and they've actually connected and you've seen their soul for just a couple of seconds, you really can't describe the feelings as a practitioner, much less a parent. But it's one of those things that keeps you going. It makes you want to keep doing things that you know are probably risky in the eyes of the medical world. I mean, we try to stick very close to the NIH criteria and the work that Sweeto's done and Cunningham has done and all that stuff. But I mean, bottom line is you got to go off the rails, dude, a little bit to do this. And you do it because you see those changes. It's called vindication.
Yeah.
That's my own personal issue with this is I've got to fix as many lives as I possibly could have been involved in destroying by practicing traditional medicine. And it's not to say that traditional medicine is bad, dude. It's great.
Right.
I'm not that diametrically opposed person where I'm way over here and I'm Mr. Anti-vaccine guy. I definitely think there's problems, and I think there needs to be better screening tools, and I think there's a lot of stuff in vaccines that are probably not disclosed. And by the way, there's been a lot of papers that have come out that says that some of the vaccine papers that have been made, there's malfeasance in those. But at the same time, I think that there's been some pretty neat stuff that's happened with vaccines, and I think there's a big future for them if they clean up their act a little bit. So traditional medicine, I think, has been fantastic. Functional medicine, though, I think has filled in the gap of their weakness. Gotcha.
So what's the future of functional medicine right now? Where do you see that? You talk about integration from a neurologic aspect and health coaches and nutritionists, et cetera. If you can just single in on functional medicine, where do you see that going as more and more research comes out on the Genome Project, on nutrition, on the immune system, which I think is the final frontier for functional medicine? But
it is.
Where do you see this?
Well, I see this. There's going to be more and more medical doctors or healthcare providers of any type. They're going to look at this and say, you know what, we're missing something. We're in a world now. I'm going to get a little more political on you, okay? And I apologize for that.
That's all right.
Out there. This is not going to be a Trump and Hillary thing. This is just going to be a political thing. And I'm going to say this: standardized medicine that is becoming maybe, let's just say, a tad bit socialized, or let's just say this. Everybody gets health care. Everybody can come in. Every doctor knows that every room, you can put a person in there for 8 minutes and 8 minutes only. And that room has to fit so many people in there in order to make money. And that person is only going to get this much care, even though they may be on 13 medications. We've got to figure it out in 9 or 10 minutes. Okay? They are all figuring out very, very quickly that model makes not enough money. You have to hire too many people to take care of the paperwork. You don't have the time to take care of that patient the way they need to. Your malpractice probability goes up. Tort reform is not changed.
No.
Your overhead goes up.
Yep.
You've still got student loans, but your reimbursement is tanking every freaking year.
Right.
So call me an I'm not saying this, this is not about socialized medicine. This is about reality, dude. I've worked in it. So what I'm telling you is there's more and more doctors that are saying this. Screw this. There's got to be something more out there. Doctors are really not stupid people, and they really do have hearts of all types, and they want to help patients.
Right.
And they're also business people too, a lot of them. So they're saying this. What can I do to help my patients? How can I make more money? How can I, make more cash, but deliver a better service that's worth that cash?
Right.
That's where your functional medicine doctor comes in and says, look, man, I got the skills to do this. You just need to let me be involved. Or there's a lot of functional medicine practitioners out there that are like, I don't need that. I just got my own practice. But on the other side of this coin is not just the doctor, but there's the patient. And they're saying this. I'm tired of an 8-minute visit. I'm tired of only being able to say I have one chief complaint.
Right.
I'm tired of not getting any diagnostics.
Yeah.
I'm tired of getting the same medication. And if it doesn't work, I'm being told I'm crazy.
Right.
So it works on both sides of the equation, dude. And so when you look at it and the equations, and by the way, I'm a statistical guy. So when A and B and C and D and all these things don't add up, something's got to change. The thing that's going to create that change to happen is the functional medicine, with the health coach, with the medical doctor that's compliant, or the DO that's compliant, that will talk to a functionally minded PT or an OT or a speech therapist, and the nutritionists will get on board, and the dietitians will get off that damn food pyramid. I mean, there's all these things.
My plate.
Yeah. There's all these things that I'm hoping will start, to gel a little bit, so that it's not just a one fee for service thing.
Right.
And it's not just, can such and such care take me out of my misery? It's not going to. I mean, if you have to go to the heart cath lab, fine. They'll probably get paid for it. If you have to have your hip replaced, get in line. If you got to have your knee replaced, get in line. But when we're talking about true wellness, man, wellness, I think more and more Americans are like this. I don't want to be like my parents.
Exactly. That's the statement. That's the T-shirt of the last 10 years right there.
Yeah, I don't want to be like my parents. I don't want to have X, Y, and Z. Well, functional medicine practitioners are really more about looking at people and saying, this is your weak spot. This is what we need to fill in. Okay. That's the answer. I mean, when it comes to end stage disease, we all know it's very difficult.
Yeah.
When it comes to prevention and wellness and then that kind of in between, we know that functional medicine probably has more to offer than anything else. So there's a rut and there's a lane. I mean, man, if you've got cancer and you got a giant brain tumor, sometimes, it's end stage. It's got to be taken out.
Mm-hmm.
But, sometimes doing things in life to prevent your body from becoming that sick and that poorly regulated, that needs to be considered in other people that may be related to that person. So I'm a very realistic person in knowing that everybody has their lane.
That's awesome. So what we'll do here, Doc, is just before I wrap up, I'm going to ask something maybe a little bit personal, but one of the things that I'm feeling from you here as I'm listening to you talk and asking you questions is your passion for the person that doesn't have a voice, your passion for the person that gets ignored. I just want to tell you thank you for that. Okay. So that's a big deal.
Where I get that from the parents, man. The parents have been screaming. They go to their pediatrician, they're told they're stupid. Or they go to their pediatrician, they're told they're paranoid. Or they go to their pediatrician, they're told there's nothing we can do.
Right. They'll grow out of it.
Yeah, they'll grow out of it, or it's just the way your kid is, or maybe you need to be a better parent or take this drug. And sometimes those things are right. By the way, there are some bad parents out there, man. There's some bad parents. There's some situational things that need to be dealt with. But I think where I get I get this link, this emotion is, from the parents that come in and, dude, they are broken to the point of you start getting very concerned about their well-being, and divorces out the yin yang. And, that creates more brokenness. I mean, how can you expect people to heal and that kind of stuff? So, I mean, I think that maybe I've just become a voice, which is a very small voice. It's not much, but at least it's something where you're sitting there and you're like, you know what? Parents hurt. Kids are sick. These kids, I'll point right at the camera. These kids are our future. Okay? Somebody has got to be the future of this planet. You take a look around at what's going on right now. Things are not necessarily what I would call the best they've ever been in society. How can we expect that to happen when we have brains that don't work the right way? You can't. 100%. You can't, dude. And so somebody's got to do something. So, I'm just like, you can only scream so loud before you become a lunatic. So, you just try to keep a subtle voice, try to teach. It'd be better to have 100 people talking in a quiet, moderate tone than 3 people yelling really loud, like like a couple of idiots. So I've been involved in all those crowds. So don't get me wrong. But I mean, it's spreading, dude. I got hope.
Yeah, and I think that's the message, though, is have some hope. I think that the message is gaining some traction. And right now, you just delivered that same message in a really non-lunatic fashion, by the way. You just delivered that message.
That's the best compliment I've had all day.
To quite a few people. So I appreciate that. If you are tuning in with us here, we're listening to Dr. Brandon Brock out of Dallas, Texas. And I just wanted to say thank you for being on the podcast today. And I'd like to have you back sometime, if that's all right. If you'll have us, that would be awesome.
Anytime, man. We'll talk about whatever you want. It's been a good time. You're a good host. You are the man. I appreciate you letting me be on, and it's been a good time, man. Happy Thanksgiving to everybody.
Thank you. Happy Thanksgiving to you as well. And we'll catch you next time. All right. All right. Thanks, Doctor. I appreciate it.
Thanks.